Welcome back to another video where we break down digital health into the basics. This week we're going to talk about where digital health is actually used in real life. And let's be honest, it's everywhere. The NHS use digital health solutions, product, tools to improve patient care, streamline processes, improve communication, and help with various aspects of healthcare delivery. So let's start with the most obvious, hospitals. Hospitals are full of digital health technologies integrated in various different ways used by many different people. The most obvious, biggest and most common is what we call electronic health records. You may call it Cerner, Epic, EMIS, or even Nerve Center, or maybe a term we're not even familiar with. So what is an EHR? An EHR is a store of medical records for a patient. And it's, the medications they take. Do they have any allergies? The documentation from ward rounds. It's information such as where they live. It pulls across the blood test, the x-rays, the scans, the imaging. And why is it so important? EHRs can improve the efficiency for which care is delivered by patient, because it means everyone on the healthcare team can access these important records. And we all know 70 to 80% of a diagnosis in the history. And it means we're not fighting over this paper folder full of patient records that's everyone's fighting over, and they can often get misplaced or lost. So some of the more new digital health solutions that are coming to the market, or you may have even used, is the replacement of bleeps. There's a company called Infinity Health, and what they're doing is they want to scrap the old school bleeps, that old school device that goes off at the most awkward situation and you need to go see a patient or someone needs to ask you a question. What Infinity does, it digitalizes it. It gives you a phone, and instead of it going off, it records and logs the tasks that have been assigned to you, and it triages them, so the most important to the least important. So you're not in the middle of doing a procedure and you have this blaring alarm going off. This is one of many digital health tools and platforms that are replacing the traditional pen and paper, as I like to call it. There's other digital health tools I use, medication management apps. During COVID, you probably remember there was a big rise in telehealth. So what is telehealth? Telehealth was an opportunity and a way for doctors to give care, to have consultations with patients remotely. And since then, it's become super popular. And it's really allowed access to care and make it more accessible. For who, you're probably thinking? For patients that probably have difficulties traveling to hospitals, they might not have the support we have, or for people that live in very rural areas where, believe it or not, there's only one bus journey, once in the morning and once in the evening. Telehealth gives these people a chance to get the care they deserve and sometimes desperately need. So digital health isn't just limited to hospitals. It's also in GP practices and your local practices. The way GPs communicate with patients for scheduling, sending out SMS reminders. You probably heard of a company called AccuRx, which allows GPs to communicate with patients. GPs also use teleconference and telemedical tools to have remote consultation with patients. There are apps where patients can take pictures of rashes and skin lesions and send it to a GP, and the GP can make an assessment if they need to come in or if they need to go into A&E. So digital health isn't just limited to hospitals and GPs. As medicine becomes more and more specialized, so does the tools and platforms available to clinicians. An example in the world of dermatology is a company called Skin Analytics. So what does Skin Analytics do? Skin Analytics is an app which allows patients to take pictures of skin lesions, and it then uses AI to assess if that lesion is showing signs of cancer. And if it is, does it need to go into a 2-week wait pathway? And according to the website, the most recent report, they've said they've been able to calculate if a skin lesion is cancerous in 99% of all the cases. Just when you think digital health is for hospitals, for clinics, for GPs, it also comes into patient homes now. Where before people were waiting for discharge, waiting to make sure the inflammatory markers were reduced, make sure their oxygen saturations were safe, patients are now being discharged safely into the community under what we call virtual hospitals. It means they're just not 100% there yet, but they're well enough to be at home, well enough for a nurse to come around and administer medications, well enough for nurses to monitor the observations in the comfort of their own home. And if needed, for medical teams to intervene and step in when necessary. It means patients aren't stuck in the hospital bed when they are well enough to go home. It means patients that do have dementia or become uncomfortable and can't really recover because they're in unfamiliar environments. Digital health now allows us to have virtual hospital, virtual wards, remote monitoring. There's another cool company called Swavera. So what does Swavera do? Swavera allows patients to manage long-term conditions like blood pressure, like diabetes from the comfort of their own home. You probably remember when we were medical students, we used to advise, keep this paper diary, log your blood pressure, bring it in on a week-to-week basis. We don't need to do that anymore with companies like Swavera. You can record the blood pressure measurements on your app or flag. You can then meet doctors and consultants and clinicians to then help you manage blood pressure, diabetes. Swavera is just one of many companies allowing you to manage long-term conditions from the comfort of your own home. Pharmacies are doing incredibly well with the uptake of digital health. They use it now for medication management, medication counseling, refill orders. Imagine a time where, as a patient, you had to travel miles and miles to go to a physical pharmacy to get a prescription medication. And believe it or not, sometimes they had to order those prescriptions because they didn't have it in stock. With companies like Caplet, that's old news. Patients, as soon as they go home, they can get medications delivered 24/7 from the comfort of their own home. If they have problems traveling, bad weather, they don't need to worry about that anymore. And not only do these companies deliver medications, they remind you about your medications. They make sure you're taking it correctly. They tell you when you need to go back to a GP to make sure if a time period has been allocated for a length of period to see if you need to increase or reduce the dose. Digital health is doing incredibly well in places like pharmacies. Just when you thought digital health is in patients, hospitals, clinics, and now we know pharmacies, it's even in education, medical education particularly. And it was even around when we were studying and in medical school. VR, AR, simulations, these all fall under digital health. And these simulations are really important. Why? Because it allows you to learn how to deal with really unwell patients without putting any patients in harm's way. There's two companies that I've been a big fan of. There's a company called Innovus, which allows you to practice surgical procedures in a simulation, allowing you to see what went wrong, what went right. There's even a cool company called Upsurgeon, and they have these little suture packs where when you cut the skin on this model, it actually bleeds. This is under digital health tools and apps. And even medical education is benefiting immensely from the tools that come to market. I hope this video gave you an understanding of where digital health is used. And it's not just in hospitals, it's not just in clinics and specialty places, it's across the board. Anywhere where patients are receiving care and there are clinicians delivering it, digital health has a role to play. If you like this video, make sure you check out the website Peerr. There's a lot more on there about the different products, the different tools, and how digital health is increasingly becoming more and more adopted in the NHS and in our healthcare system. We'll see you in the next video.